national franchise, Visiting Angels. And it's great to be a part of a franchise because then we get a lot of that professional support behind the scenes. But each of the franchises are individually owned and operated. What's unique about us is both me and my husband Ron were born and raised in Manchester, New Hampshire. So we really know the demographics that we're helping. We've had the privilege of helping many of our family or friends, colleagues out there. We've helped many, and the one claim to fame that I have is I was able to coordinate care for the doctor that delivered me and his wife. So we took care of both of them. And on top of being locally owned, again, a big part of what me and my husband and family have been involved with is tons of community support. My passion is the Alzheimer's Association. I see that this is the #1 disease, that there is no cure. And I find it very valuable to get behind an organization, very similar to like what we do with AIDS and cancer years ago, that we do need the research dollars. And I think that's important. And due to my partnership, I've been able to get heavily educated in this field and help families above and beyond what I think a lot of our competitors can do, because I'm living and breathing it and partnering with such a great organization. I like to say it's an a la carte type. We're able to customize exactly what that family needs. So we go in and we do our assessment and meet with the family or the client. Again, we really want to meet with the client. We ask a lot of those personal history questions that I think is valuable to understand where they're coming from. And then we're able to get a sense of who they are so we can start our talk about what they need help with. Again, we can just do 2 hours once a week just to help somebody with maybe severe arthritis change their bed linens and do some of those heavier chores, to round-the-clock services. Somebody on hospice care or needing that 24-hour fall prevention, Alzheimer's care. We can help with meal planning, preparation, grocery shopping, take them to their hair appointments, doctor's appointments. The favorite thing that I like to do is find out what some of their activities are and integrate that into the care plan, maybe taking them on an outing. So again, it can be very customized. And again, we ask our caregivers to have a lot of input into that as we go along in the care plan. So again, if our clients are able to communicate, they have full control. I tell them they're the king or queen of their castle. So they're able to direct their own care. And that's where I think we get a lot of laughter from them, because we want them to know that they're part of the planning process, and we're not in there to take over. We're there as a partner with them on this journey. The inclusive model, our approach is that a lot of families are going to need more care as time moves on. And normally with other agencies, that care is going to go up. So they'll add an extra $1 or $2 because they're helping with personal care and they're paying their staff extra. I have the exact opposite philosophy, that when we're in the home more, our caregivers are more invested into their care and they'll be there longer hours, so they're not traveling as much, so we're not paying them in between shifts. And again, the families want to have a budget, they want to know what to expect, and we want it to be all-inclusive. I mean, there's going to be no surprises. Our caregivers clock in and out from an 800 number, so their times are from when they arrive at the house, they clock in, and when they leave. So it's pretty straightforward that they're paid for the exact time frame that they're in the home, and they're going to know what to expect based on the tiered rate system that we use. And the tiered rate system is the short-hour cases are a little bit more expensive because our caregivers are traveling a lot more and they're going house to house, whereas the longer-hour cases are a little bit less expensive for them.